Don't ignore these early warning signs of fatty liver disease. Have you heard the term fatty liver? Well, the term is pretty self-explanatory. It's a disease that refers to a common condition caused by having too much fat build up in your liver. The liver, being the second largest organ of the human body, processes nutrients from food, which causes the liver to store a small amount of fat. But when that amount of fat exceeds the range of 5 to 10% of your liver's weight, the problem begins. Well, as said earlier, it's normal for your liver to store some fats, so when you have fatty liver disease, it won't cause your liver to perform abnormally from the get-go. The condition becomes worse with time as no measures are taken to get rid of the extra fats stored in the liver. Firstly, the liver will be swollen, which will lead to the formation of scar tissues that ultimately can cause extensive results like liver failure and liver cancer. So, fatty liver disease is a pretty bad condition to have, but is it a common thing among the population? Unfortunately, yes. According to research, almost 20 to 30% of the US population alone suffers from this disease. The fact, which adds more caution to the subject, is that in around 30% of people with the condition, the fatty liver disease gets worse over time. So, what are the root causes of this disease? Alcohol sits at the top of the list. Heavy drinking is one of the major causes of this list. Having a sigh of relief because you are a non-drinker? Unfortunately, non-drinkers can also suffer from this disease. Eating too many sugary foods, obesity, and diabetes are some of the factors that can be the reason for non-drinkers to develop this disease. Now, the most terrifying part of this disease is that it doesn't normally show up when a liver enzyme blood test is done, which can cause it to be unnoticed for a long time until the liver is severely damaged. But thankfully, our body shows some early warning signs that you have a fatty liver. What are those signs? Let's have a look. Swelling of feet. One of the symptoms of fatty liver is that your feet will get swollen. This will occur due to the accumulation of fluids in your legs. What causes this? It can be either because of increased pressure in the portal vein or the liver's inability to produce enough blood proteins. Itchy skin. One common sign of fatty liver is itchy skin. It can be due to a simple rash or dry skin too, yes. But if it's a regular thing, you should better check that out. This can be because fatty liver destroys or blocks the bile ducts in your liver. This leads to excess bilirubin in the skin, which can cause itchy skin, yellow eyes and skins. Another symptom that is caused due to the blockage of bile ducts in your liver. Your eyes and skin will become yellowish because of the high level of bilirubin in the body, which is a yellowish pigment that's secreted by the liver. You are most familiar with the term jaundice, which is another term for this condition. Spider angiomas. You can find some structures like a spider on your skin, especially on the face and leg, that can be a sign of liver disease. Higher levels of estrogen are the reason for these structures to appear, and it implies that your liver is unable to function properly, which is causing a hormonal imbalance. This sign is more common in liver disease caused by alcohol. Bruising easily. One possible explanation for this sign could be that you are simply getting older, as it makes your skin thinner and makes you susceptible to bruises. But when you find more and more bruises that have no explanations, it can be a sign of fatty liver. This may occur due to the lack of specific proteins needed for clotting blood, thereby suggesting some issues with the liver. Right shoulder pain. If you are feeling pain in the back, especially on the right shoulder, it can be due to fatty liver. This can cause because by a liquid called bile that is created by the liver. Fatty liver causes bile to become thicker, swelling up the liver. The phrenic nerve becomes affected by this, which results in pain in your right shoulder. Constant tiredness. Feel tired all the time even if you just woke up? Might be a sign. One of the most incredibly common signs of fatty liver is fatigue. Why does it happen? A study published in the Canadian Journal of Gastroenterology says that this disease does some changes to the neurotransmission within the brain, which results in you feeling tired all the time. These are some of the warning signs that are most commonly found in fatty liver patients. If you are having a couple of symptoms that are mentioned earlier, it might be a good idea to get yourself checked out. Now, to an important question: is fatty liver disease reversible? Currently, no medications have been approved to treat fatty liver disease. More research is needed to develop and test medications to treat this condition. In most cases, doctors suggest some life changes for the patients to get better. You can also follow them to ensure that you don't get the disease. Exercise. Try to be active for at least 30 minutes a day most days of the week. This will help you to lose the fats, not only in your liver, but all over your body. It will help you to get into better shape too. Boosted confidence on top of your healthy liver. Eat healthily, try to convert into a healthy diet, and give your liver a chance to thank you. You don't have to be a food inspector from the get-go. Just think twice before ordering fast food twice a day, and try to have a balanced diet. This will also help you in the process of getting in shape. Control alcohol intake. It is ideal to skip the alcohol altogether, but if you have to drink, try to limit it. The demerits of overconsumption of alcohol are very well known, so do yourself a favor and control your alcohol intake. Fatty liver can become a serious health hazard if not taken seriously from the beginning. So, it is important to become aware and raise awareness of this disease. Like and share this video with your friends and family so that they can also learn about it. Subscribe to the channel, and I will see you in another video with another health topic.